I was thinking as you were talking, Malcolm, about aligning values and how aligning values with patients and families can often align with institutional values. And when you're speaking too, Julie, about institutional values and not only benefiting the patient but the whole system, keeping people at home when they can stay home, preventing readmission is a nice way to argue for more staff and for more. Yeah, yes, yes. So we have now questions. I do believe. I think we're. Could you tell me we're done at 3:15? Are you keeping? When do you want us to be? 3:20. Okay. Okay.
Hi, thank you very much for your presentations. Christian Sinclair, representing the American Academy of Hospice and Palliative Medicine. Dr. Silver, I appreciate you introducing me to the concept of prehabilitation. I am lucky enough at the University of Kansas to have an oncology rehab fellow who is spending 1 day a week with our palliative medicine team as part of her rehab fellowship. But we are realizing that there is just no workforce that really understands that cancer rehab need and I think looking at the rehab needs of patients with serious illness, when I make referrals for our palliative care patients to PT and OT, it seems like there's a confusion there of what we're asking them to do. So are there any tips you could share with us in how to really clearly make the best use of PT and OT? Because the patients come back and say, it didn't feel like it did anything, but sometimes they have great results. So I just feel like there's a big dichotomy of what I'm getting from referring my patients to therapy.
Okay, there we go. So that's such a good point, and I've heard that so many times. And the one thing that I would say is that oncology or palliative care, they're already sort of doing that work, and rehab isn't. Rehab is, rehab sort of needs to be brought into the fold. So you guys actually have more power than rehab has in that sort of relationship dynamic, and really engaging them and bringing them over to your side or your team and basically talking to them about the different kinds of problems they have, and then also having them educate you about when to refer. One of the things that rehab folks complain about quite a lot is that patients get referred too late. It's like, why weren't they referred 6 months ago? Why weren't they referred, earlier, so we could have done so much more with them? And so really that, it is about communication and training, but you guys are on the same team. It's just that you're siloed. And so, but you guys have the power to bring them in.
I also wanted to say that sometimes as a palliative care team, we consult on patients who are oncology patients, and we watch them day after day after day lie in bed. And they get further and further deconditioned, and the consequence of that for some of our patients is actually life-threatening. They will die because people will not offer them oncology treatment because they are, quote-unquote, deconditioned and their performance status has gone down the tubes, and we have watched it happen. And so raising consciousness about that in the palliative care world, I think, is really important when the goal of a patient is to get treatment and to extend their life as long as possible.
That's such a good point, too. And one of the things I didn't say, which I meant to say, was that some patients will not get into clinical trials because of that. And so you can actually open the door for clinical trials for them. And they know that. They know that if they stay stronger and as, as healthy as possible, that they're more likely to get into trials and so on. So, I would really encourage you, rehab. I always say that sort of oncology and palliative care and these teams that are already working, they sort of have an obligation, whereas rehab has an opportunity, and rehab doesn't always take that opportunity because they're busy doing sports medicine and and all these different things. So, on the other side of the team, like really just bring them in, like, you sort of owe it to your patients, and then rehab will really help you.
Other thoughts? Wonderings? It was lovely spending time with you, and thank you so much. Yeah.